This is the Elite Medical Imaging Tips here again. If this is your first time of visiting our channel, please do well to subscribe and don't forget to engage. Tap the notification button so that you'll be notified for subsequent videos. So in today's video, we'll be looking at why diagnostic procedures are necessary and important in healthcare. Now, in most cases, you may be having some symptoms. Let's say, for instance, fever, and you take drugs for it. Now, instead of the symptoms to go, it will still persist. Now, the reason is because you're not just suffering from that symptoms. There's a root cause. There's an underlying disease or sickness why you're experiencing such symptoms. So it is necessary and advisable that you don't just treat or do away with the symptoms. You also treat the disease causing it. That's, you identify the root cause and tackle it from there. That's why diagnostic procedures are important in healthcare. Now, what are diagnostic procedures? They are examinations or tests carried out in healthcare to identify the cause of a symptoms or a disorder and sickness. They include laboratory tests, imaging tests like X-ray, ultrasound scan, CT scan, MRI, physical tests. All the procedures and examinations are what are referred to as diagnostic procedures. They are procedures carried out or examinations carried out to find out the cause of a sickness. They are investigations carried out to diagnose a sickness. So they are very necessary and important in healthcare in the sense that they help us identify a very root cause of a symptom, so that to help us tackle that very symptom from the root cause. So let's look at why they are important and necessary in healthcare. The first importance of diagnostic procedures we are going to look at today in healthcare is number one, accurate diagnosis. Diagnostic procedures help us to diagnose a sickness accurately or a disease accurately. Let's say, for instance, you are having some symptoms, you are having some disorder within your body, and you want to know what's causing it. Diagnostic procedure will help us tackle it and give us the accurate diagnosis. For instance, you're having headache. You go to the hospital, you complain to your health caregiver or your doctor. He will examine you, then advise you to carry out some diagnostic examinations. And now the result will come out, and let's say, for instance, the result comes out that you have 2 cases of malaria. So that's the accurate diagnosis from the diagnostic examination that you took or you underwent. Another importance is personalized treatment. Diagnostic procedures don't just give us accurate diagnosis, but they give us also personalized treatment. They identify the drugs that you are sensitive to. They identify the drugs that you are resistant to. Our systems and cells work differently. So I might be sensitive to a particular drugs, while the next person will be resistant to that very drugs. So diagnostic procedures help us to know these drugs that if you take, it works for you, and if you take, it won't work for you. So that's why diagnostic procedures is important in healthcare. Another importance is optimized dosage. Diagnostic procedure also help us to optimize the dose. Now, it's identify the level of the sickness or the disease. Let's say, for instance, if it's a microorganism, it identifies the growth. So it also identifies the dosage you are supposed to take in order to completely eliminate the cause of that symptoms you're having. Another one is also monitor progress. Now, let's say you went to do a MP test, that is a malaria parasite test, and you find out that you have 2 pluses. Now you start taking medications. Now after some time, you have to go back to also undergo that test. Now the second test, that we now evaluate the progress and also monitor the progress of how you are getting relief from that parasite. You understand what I mean? It monitors the progress how you've gone so far, how you're responding to treatment. So let's say you carry out a test and the sickness was, let's say, 50%. So you went back, it has now reduced to 10%. You understand? So it's giving you the progress until it's completely eliminated. So another one is reduce the risk of medication and self-medication and drug abuse. So when you undergo diagnostic procedures, you are saving yourself from the risk of drug abuse. Some persons, they might just be in their house and they have some symptoms. The next thing, they become a doctor to themselves. They prescribe drugs for themselves. Maybe they have Panadol in the house, they just take it without seeking the attention of a healthcare giver or know what's causing that headache. They become self-medicated and it leads to drug abuse, and we know there are risks to drug abuse. So it's not good that we just, maybe if you have some symptoms, you just take drugs without knowing what's causing it, without knowing the root cause. So you need to carry out diagnostic procedures, you need to carry out diagnostic examinations to know what is causing these things. You need to investigate what is causing those symptoms so that you know the exact sickness and the exact disease or the exact parasites in your body, so that you tackle it from there. I believe this video was helpful. Diagnostic procedures are very necessary in healthcare. Don't be a self-medicated person, or don't be a drug abuser. You just take drugs as you like. Based on you have paracetamol in your house, you believe you can take it as you like because you have some symptoms. No, it's not done that way. You need to know what's causing it. So let's not joke with diagnostic procedures. They are there to identify the cause of our symptoms. Thank you for watching this video.